I think that technology can play a good and a bad role in, I guess, improving or exacerbating healthcare outcomes as well as isolation. I think what happens sometimes in health is we take offline interventions and ways that we work offline and we translate them online. What's really important is that we bring different people from different backgrounds together through the co-creation process of these technologies to be able to think about how they can meet the needs of different people so we don't exacerbate that inequality gap.
The value comes in them essentially being with you most of the time and being personalised to what would be helpful for you in terms of sort of mental health, in terms of nutrition, in terms of exercise, as well as simply reminders for taking medicine.
I've come here today in the capacity as I work for a charity called the Virtual Doctors. We're based in the south of England, and we offer remote telemedical advice to clinical officers in Zambia, so they will have had a year or two of basic medical training, and then they are sent into rural health centres where anything can come through the door. The idea is that if they then encounter something that they're not entirely sure about, they log in, they send a message through an app, through a tablet or a phone, and then it will come through either to a doctor in Zambia or more likely to a doctor in the UK on the email, and then we log in, send some advice back, and that's really helping avoid patients needing to trek for a day or two to try and get to a hospital when we can give them advice sort of remotely.
I feel like, especially when we're looking at mental health statistics, they are over-exaggerated, especially when it comes to the Black community. If someone, for example, is diagnosed with schizophrenia, they're, I think it's 4 times more likely to be prescribed a drug rather than given like CBT or some other kind of behavioural therapy. So I think digital technologies could help with reducing that by letting or giving people access to being helped online in forums, in connecting with people. I feel like you can even get online therapists now, which I think will be beneficial.
Technologies as simple as tablet-based training tools or virtual reality allows healthcare professionals to access people in their homes and also in their day-to-day world. And so we know that our mobile phone and our smartphone often is with us all the time. It's collecting loads of information about us. So to be able to provide a mental health intervention, or to be able to have the ability to be able to monitor your diabetes or your blood levels or your heart rate via your smartphone is really empowering for people and individuals. And I think what's really important is that we teach people the capabilities of the technology. We're aware of who can access technology in different areas.
And we need to understand and make them accessible enough and easy enough for people to use that they're of value.